Welcome to the Two Marketing Moms podcast.
Two women with 50 years plus of marketing
Integrity
experience.
and culture are extremely important.
You can still say, I don't know.
Stop multitasking and be present in the moment.
Moms have balls, big time.
Welcome to the Two Marketing Moms podcast. We are two women with more than 50 years of marketing and advertising experience between us, and we want to talk about the struggles, the fails, and the wins that we experienced while building our careers, being a boss, juggling work and a home life, and arguably the hardest and yet most fulfilling job, being a mom. This podcast was created for marketing and advertising professionals, especially the up-and-coming marketing stars of the future. We hope these tips, tricks, and advice will help you navigate work and life and get ahead.
I'm Kelly Callahan Poe from the Two Marketing Moms podcast. Today we're having our 36th episode, and the episode is called Workplace Mental Health, Creating a Culture of Support, with two special guests, Taylor Adams and Khendra Lucas from Mental Health America. Welcome, Taylor, and welcome, Khendra.
Thank you so much for having us.
Thank you. Thank you.
We're so happy to have you and so happy to learn from you guys about mental health. Can you tell us a little bit about Mental Health America and what led you to the organization and what work you do now?
Yeah, sure. I'll start. So for anyone who's not familiar with Mental Health America, we are a national advocacy nonprofit that promotes a B4 stage 4 philosophy. So basically, we want to address mental health conditions and their symptoms and provide support as soon as they manifest. And we are a national office based in DC, but some of the staff, like myself, work remotely. And speaking of myself, I am Khendra Lucas, a research associate at Mental Health America, and I'm based out of Memphis, Tennessee. So I help to manage the operations for the Center for Research and Innovation, manage data from our screening program, which I'll talk a little bit about later, and help to create content for resources after a screening, which I'll also talk a little bit more about. But prior to MHA, I majored in biomedical sciences and psych, and I did that in the hopes of becoming a doctor, which, as we can see, that didn't work out. Around my senior year of college, I decided that that wasn't the career path I wanted to take. And so I ended up going straight into the nonprofit sector. I was just really interested in systemic issues and how they're affecting everyday lives. And so I got involved in some really rewarding work, doing health screenings for low-income families, doing free income tax prep. I ended up running a free tax initiative, which was just way off from my degree. And I love taxes. People call me the tax lady now. And I ended up doing a countywide tax project. And while that work was fulfilling, and I loved it, it just wasn't exactly what I wanted to do. So one day I was scrolling on LinkedIn, just looking at opportunities, and Mental Health America popped up, and it just really attracted me based on that B4 stage 4 philosophy. I was really interested in their interest in prevention, especially with youth. Their prioritizing of lived experience, and just the fact that I was able to channel all of my professional experiences into one position. I don't know if Taylor knows this, but I do also have like an interest in workplace mental health, and I see my career path taking me along that route. And so anytime I get a chance to collab with Taylor, I take it. She's great, a mighty team of one, but she gets so much done. I just admire her so much. But I don't want to talk too much about her because she can do that.
Nice team.
I'll let her talk more about what she does, but she's amazing.
Oh, thank you. Actually, the most surprising thing was learning that you are into taxes. It could be super helpful with that. So I'm gonna keep that in mind.
We're all going to be calling you now.
Yeah, I shouldn't advertise that. Yeah, so my name is Taylor Adams. I work as the Director of Workplace Mental Health at Mental Health America. I guess try to convince organizations why mental health is so important to think about and prioritize what are the right types of policies, programs, or interventions that they should be looking at to actually improve worker mental health outcomes. I did not ever expect to get into this type of work. I've been with MHA for 6 years now, but I've been working specifically on workplace mental health for three or four. And it was more just like this opportunity kind of opened up at MHA, and that's something that's really great about working at the organization. It's very fluid, and you can kind of try new things and think big and experiment. And this was one of those things where they're like, sure, take a stab. Let's see what happens. And we've really built out that program since. And it wasn't until I started doing like these conversations and presenting and learning more about the topic that I was drawing parallels to when I was a student or a young adult. I've worked in nurseries, daycares. I've worked at fast food restaurants and banking and all across the spectrum of different type of industries. Anything I can do just to learn different things. And there were some really great job experiences and some really terrible ones. And
Yes.
I dealt with like depression when I was in high school, and like that. All the things that contributed to that. It all came together in this position now, and I see those relationships.
Wonderful. Can you explain a little bit about what before stage 4 means? I mean, you went through real fast about that, but just explain what that means in your terms, because it's a campaign that you use. And I think people know that stage 4 means it's really bad. So what does it mean for before stage 4 for you guys?
Yeah. So when you think about physical illnesses like cancer, and you think about the stages 1, 2, 3, and 4, as a society, we tend to be more in tune with our physical health. Like, yes, there's still gaps there, and yes, we still need to figure out how to expand access to care. But when it comes to mental health, the scale is just not the same. People don't address these issues or address depression as they would cancer. So you go get a screening, you go get a mammogram. But for mental health conditions, a lot of people are just not literate in what treatment is out there. Yes. And so we want mental health conditions to be held in the same regard as physical. So when we talk about before stage 4, we want to think about prevention. We want to think about, okay, well, maybe we didn't prevent it, but maybe somebody's in that early stage where they're trying to figure out what's wrong. We want to think about those people who are in that moderate stage. We want to think about people that are in that severe stage. And so we want to get to those people before their mental health symptoms start to manifest into something else, or to where they're at the point where treatment is just not viable or not as easily as attainable. So that's what we're all about. Just that key prevention piece.
That makes a lot of sense. Well, obviously mental health has been top of mind since COVID. And can you talk a little bit about how COVID has impacted mental health in the workplace? And I think you may even have a lot of stats and figures on that as well.
Yeah, sure. So I'll start. So every year, the research team releases a report called The State of Mental Health in America. And it's exactly what you think. We take data from every single state in DC and look at the prevalence of mental health conditions. And we found a lot of key things from this data. For example, 1 in 5 adults in America are experiencing mental health condition, and most of them are not receiving treatment. 2/3 of our youth with severe depression aren't getting treatment. And probably the most disheartening stat from that report is that the ratio of individuals who are seeking treatment to the number of mental health providers is 350 to 1. So that means for every 350 individuals that need treatment, there's only 1 mental health provider that can help them, which just really exposes that gap. And so I love the State of Mental Health in America report. It's very long, so I don't want to get too much into it. But another thing I like about the work that we do with MHA screening is that it provides a little bit more context, because there's a little bit more to the story. So yeah, we're able to see who has a mental health condition, but we might be losing sight at who might have not gotten diagnosed yet, or who's just not in the system, or those people who just aren't reflected in those numbers. So people who come to our site, they are what we call help seeking, And so they're generally experiencing symptoms of some condition. They might not have a lot of mental health literacy. They probably haven't gotten diagnosed yet. And so these people come to our site, they voluntarily take the screening to try to get some answers and look for resources. And at a staggering about 75% of people who come to our site and take any screen score at risk for a condition. And so we've been able to not only provide that resource for them and give them a stepping stone, but also channel that information into valuable resources. And since 2014, we've been servicing over 19 million people, which is just wild to think about. But touching on COVID, that's really kind of inflated our numbers. If you think about it, you know, when the pandemic first started, everybody was quarantined, everybody was isolated. All you can do is just sit there and you're kind of just more aware of your thoughts. You're more aware of your brain. And so a lot of people are going on Google saying, I'm very, very sad, or I'm very, very lonely. What's going on with me? And so we definitely saw a rise in depression screens, exponential rise in anxiety, bipolar screens. And that trend has kind of stayed throughout the pandemic. More interestingly, as we're kind of adjusting to this new normal, we've started to see a little bit more interest in ADHD, and it's quickly become one of our more popular screens. And so now we're starting to see that our priorities and our thoughts are kind of shifting from I'm lonely to, okay, I've just been stuck in the house and now I have to go out into society and be productive. I can't pay attention. I can't stay on task. So that's been interesting to see. And another interesting stat I want to bring up, because I don't want to take up all the time because I know Taylor's just waiting. But she will let me talk all day. She will let me talk all day. But we also asked our screeners, what are your top 3 main concerns that are affecting your mental health? And for a while, loneliness and isolation was number 1. Of course, it makes sense. We're stuck in the house. We can't talk to people. However, in this past year, we're also starting to see a shift where people are now more focused on their body image or their sense of self and their relationship dynamics. So again, we're getting back outside and we're being a little bit more productive now and we're adjusting, but there's just been some semi-permanent or permanent damage that has just affected the way we view ourselves and the way we interact with people. And so while things are starting to slow down and stagnate, that mental health crisis is still dire. We're trying to think more about how, you know, just being around tech all the time, we're overstimulated. We're not able to, like I said, focus or keep our attention as much. We were stuck with ourselves the entire pandemic. So now all we can do is just sit there and analyze ourselves. And now our self-esteem has been affected and we can't interact as much as we want to or as well as we wanted to before the pandemic. And even though school and work problems was not the number 1 issue, it was in the top 5. And there are a lot of people still reporting issues with school or work, especially youth. And so that might be a reflection of personal issues trickling into school or work. It might also just be a reflection of work stress, which I'm sure Taylor might have a little bit more insight on because I'm not well versed. So if you'd like to go, Taylor.
Well, I just wanted to pop up on the screen for those that are watching on YouTube what the mental health tests look like, the screeners that you mentioned look like, because there are so many of them. How many of them are there? 15, 12?
So there are 11 clinically validated screens, 2 Spanish screens, and then 1 survey, that self-injury survey, which is not clinically validated.
And your number 1 screener is the depression test. Is that correct?
Yes. Yep.
And so when someone takes the depression test, what happens when they get the results?
So they'll either get a result that says like mild depression, moderate, severe, and then we'll kind of try to provide links to resources after that. So not just giving them a result and then just be like, oh, okay, you're done. But and I can talk more about our content later, but we have resources like articles, crisis centers, peer support lines that we try to provide to people just so that they can have a next step after screening and aren't just stuck with that information.
So the mental health tests, all these screeners that we're talking about for a variety of mental health issues, they're free, correct?
They are absolutely free. Yep.
Wonderful. Okay. Taylor, what are your thoughts?
Yeah, I I don't have as many interesting stats as Kendra. I will just say that, but just to add a little bit more framing around the specifically the workplace, I mean, mental health issues, mental health conditions have always existed in a workplace context. It felt like there was a bit of a silver lining where the pandemic brought that to the forefront, really made it a priority for employers. Um, but it was definitely like, Kendra was saying, a time where people were reevaluating life priorities. And for most, that's not going to be work being your number one. So I think it was like the peak of the pandemic. It's like 4.4 million people had resigned from their jobs because of all these life changes and shifts and adapting and pivots that people had to do. And we saw from our own work health survey that 78% of workers report, that stress was affecting their mental health, that this was leading to bigger mental health concerns like burnout, but even depression, anxiety, and other conditions. I think there are positive impacts, not so much the pandemic itself, but the consequences of it or how people responded, in addition to the negative. But we saw a shift in the way that people work. We saw a little bit more flexibility in that they could balance their life in addition to work responsibilities. They can take care of elderly parents or take care of children or schedule therapy appointments during the week, so they had more flexibility in their work hours. So that's something I hope to see continue. I hope people don't go back to where we were before, where everyone's forced to come into the office, because it's been working really well for some people to have remote work options, flexible work arrangements, that sort of thing. We also saw a lot of organizations increase the type and improve the benefits that they offer as it relates to mental health. So adding number of employee assistance program sessions that they could have, improving the quality of the health insurance plan that they offer. But then, there's also some things around where the negative is like redefining what a work life boundaries look like.
Yeah.
Like here, this is actually technically my craft studio, which is also my kitchen table, which is also my office. And it's like that's a lot more challenging to manage than if I had a designated space like I did going into the office every day. So
That you could leave.
yeah, yeah. I'm like, I never leave this place. It's only to walk my dogs, which is fine. But I think overall it's the like growing, like the people entering the workforce, so some of these younger generations that are coming into the workforce, there's now an expectation that a workplace has to pay attention to these issues. It's no longer like a perk that they think about this. It has to be kind of integrated as part of an organization. So I think that's a positive, just a positive outcome of on the other end of this.
Love it. So how can you recognize when work is affecting your mental health? And or how can a boss or a colleague support someone who they know is struggling? What would you recommend?
Yeah, so we actually have and it's weird, I don't know what you do on podcasts when you have something linked, but we produce a lot of content, including
I will link to all of the content on the
great.
Yeah,
Perfect.
correct.
So we do have printable postcards that has like actual like 11 steps to talking to an employee with a mental health concern, so that people can kind of have it on hand, because you're not really like turning to your phone when it's a situation or doing research. And there are things that focus on stress, burnout, what is the difference between burnout and depression, because those symptoms often look similar, how to have those more difficult conversations but still keep that kind of sense of professionalism and not feel like you're asking too much of someone. But stress often leads to larger mental health concerns when it's chronic, when it's unmanaged, when it is interfering with your daily activities, like, you know, when you go home and get upset at the dog or you yell at your husband, or it's just affecting your behavior in ways that wouldn't have happened if it wasn't for the impact of that stress on you. It could affect you physically. So any like major change in like habits or behaviors as a result of workplace stress, it's a good indication that's like, okay, we need to take a step back and reevaluate how to manage this. And then if it goes unmanaged, so chronic stress can turn into burnout, which has very similar symptoms to depression. It's you're emotionally exhausted, and exhausted in general. You have a reduced self-efficacy, so you're just not motivated. You don't have the confidence in yourself to get things done to the best of your ability. And then you become cynical, which is kind of your kiss of death for burnout, because it's really hard to come back from that, because it's you start to harbor bad feelings towards your coworkers, towards your project, and it may not even be about the project itself. It was just unmanaged stress from that just built up over time.
Interesting.
Yeah, and in terms of, so I'll give like the very quick, you know, how to be a supportive colleague. I think everyone had a crash course in this, because
True, we
everyone's
did.
having these conversations over the pandemic. They're like, we're all suffering. But just it's really good. And this is for any context, not just a workplace, but asking open-ended questions in a non-judgmental way, allowing the other person to share what's comfortable for them. Apply active listening skills. And I also like to include, keep in mind like your like the emotional intelligence that you know you can apply to that situation, being compassionate for the person that you're speaking with. It's always good to validate their feelings, like, yeah, no, I understand that, you know, that's really difficult to go through. And then, and especially in the workplace, it's good to familiarize yourself with what is available in terms of support, but so that you can kind of direct them to what's appropriate. So it could be, maybe you should talk to your manager about this, or, you know, HR has this program where you can like anonymously share something that you're upset about, or whatever the example is, but just maybe have a couple go-to supports that you can share as well.
And MHA is a pretty supportive environment. You have a unique space that I visited once. What is that? Tell me a little bit about that unique space, or tell everyone about that unique space that you have that every office really should have. What is it?
Kendra, do you want to kick it off?
Since I work remote, I haven't had enough experience in our little wellness room, but I know we just have like a nice little couch.
Oh, I just thought it was called the nap room.
I think it's actually called the wellness room. Yeah. You go in, yeah, you go in, close the door, lay down and nap. It's beautiful.
I love it.
It's great to have those spaces where you can just woosah. Like a lot of employers think that you just have to be all work, work, work all the time, but they don't realize that being able to allow your workers to just have a space where they can breathe and just say, nope, I'm just going to take a break and y'all see me in 10 minutes, but I gotta go. And people being flexible and supportive of that, like it does wonders for workers' mental health. It does wonders for productivity. You would think it didn't, but those little nuggets of just breathing room like make all the difference.
I love it. I love it.
Yeah, it's a hell of a lot better than crying in the bathroom at work. At least there's a private space to do it. It has pillows and a chaise lounge and a little bit more cozy. But even in general, because we have since switched to I feel like a majority of us do work remotely. And before we were more close knit, going into the office every day, working remote on certain days. And I feel like MHA's done a really good job of trying to figure out a good system where people can work remotely, have that flexibility, but then also stay socially connected, and kind of reduce some of that isolation, because it'd be really challenging. You know, Kendra, you joined us when we were already remote, and you just don't have that same water cooler chat that you do going into an office every day.
Yeah.
But I think they do a good job of trying to keep us having staff retreats, and we are required to come in certain times of year. And we have a lot of social events, and it's, you know, half of it's socialization and then half of it's business. And so that's an aspect of MHA's culture I really appreciate. And then adaptability too, because we've all been trying to figure it out as we go, and it will continue till we die, I'm sure.
Well, how can employers create a mentally healthy and supportive work environment?
Yeah. They can do a lot. There's a lot of different things that contribute to better worker mental health outcomes. It does require investment. So time, intention, action from different levels of an organization. So not just leadership, not just your workers, not just middle management or your people managers, but everyone has a role in how they can help create that culture of support. Not just spreading awareness about mental health, but making people feel good coming to work, or making people just feel good in their daily interactions. I think a really big thing, especially if you're a decision maker for an organization, is having something in place to measure, and then having a response to employee feedback. I'll often hear comments from organizations that say, oh, well, we don't really hear any feedback from our employees, like everything seems like it's going fine. And it's like, it may be a culture where people don't feel safe to speak up, for one. So maybe the measurement the tool isn't there to get that feedback. But also being responsive to that, because I think no one likes having to take a survey and then not seeing any of the results of that. Also, a really big piece is having fair and effective people management. We see that usually when people go up in their careers, or they're promoted and they take on more responsibility, they'll take on a team, or they'll take on hiring people. And without that like extra support or training around like managing people is a very different skill set than maybe your previous job, but the work that you did as a program manager, for example. So I mean, that's one of the things they say is you don't leave bad jobs, you leave bad managers. It's very it's really, really tied to mental health and how people feel and their experience at work. And then I think there's a ton of different things we could share, but creating an inclusive work environment. So for example, MHA really strives to have a workforce that are people with lived experience, because we're a person first advocacy organization for mental health. So a lot of us, not everyone, but has lived experience with mental health or substance use. And that's something that as a culture, it feels really good to be able to, we can talk about like our therapy openly, or we talk about like, oh, I can't find a therapist, they're out of network, or like these things that without having that culture of inclusion and feeling like they're addressing those things and being very intentional about it, would be difficult in other work environments. So
what I love is that you guys clearly live what you practice, but you preach. I think when I emailed one of you, I got a response back that someone was taking a mental health day, and it reminded me, okay, that's absolutely valid, and people should be brave enough to be able to say that. So I thought that was impressive to be able to hear that. Well, what sort of resources, we've talked about some of the resources that Mental Health America has to help both employees and employers. We showed the Mental Health America screenings, the 11 different screeners for depression, et cetera. What other types of tools can help the workplace?
Yeah, I could talk a little bit more about our resources after screening. So I touched a little bit on our articles. And so we want to make sure that we are not only providing support as far as like helping people figure out what might be going on with them, but also advancing mental health literacy. So we want to make sure that we have articles that are accessible. So we try to make our reading level as low as like 4th grade. And we try to make our titles stuff that people Google. So you'll see non-traditional titles like, Am I crazy? Or I don't want to go to therapy, or my family member doesn't want to go to the hospital. And we try to mold these articles and convey information in a way for people to understand. And we have I don't know the number, but we have so many of those. And we want to make sure that people, they see that they might have severe depression and they're like, oh, okay, what's depression? Like, we want to make sure that people are able to understand exactly what the condition is and what support is out there for that specific condition. We also have do-it-yourself tools that we're pioneering. So these are basically modules that kind of help people reframe their thoughts. So somebody thinking, oh, I'm a failure because I didn't turn in my work project on time, maybe reframing that to say, I'm not a failure. I just needed more time to complete the project, or it's normal to miss a deadline. So kind of just taking that pressure off of yourself and creating a healthy mindset that's based on like cognitive behavioral therapy techniques. And we also have modules to help kind of destigmatize those conversations, especially related to substance use, because I think our stat is around 90% of people with substance use disorders don't receive treatment, which is staggering. And so we want to make sure that those specific people know that help is out there and it's okay to talk about. And then in addition to those, we also provide links to alternative resources. We're really big on peer support, because the power of just being able to talk to somebody who you feel you can relate to is important to destigmatizing, but also giving someone the initiative to go get help. We also do like warm lines, so peer support lines, crisis lines like 988, therapy directories, and all of these are on mhascreening.org in that central location so that it's easy to find. We also have resources for organizations and schools that are looking to implement screening. So that can be as simple as just providing a link on your page to MHA screening, all the way up to just creating a whole curriculum surrounding mental health screening. And so if anyone is interested in just implementing a organization-wide type effort, those resources are also available.
Wonderful. And Taylor, on the workplace side?
Yeah, and I just wanted to say the work that Khendra and her team do is just so awesome. I still can't wrap my head around just all the stuff that they've managed to accomplish in a short amount of time. But I think what's most striking about all of this is that it does take people, I don't know the exact numbers, they're like up to 10 years for people to find treatment after having symptoms, come on for a mental health condition. 10 years. It's like, if you were to like break a toe, you're not waiting 10 years to get that help. And but what's even more fascinating, it's like people, they aren't likely to just go straight to the mental health professional, the provider. Maybe they don't have access. Maybe they can't afford it. There's so many barriers, even if you do, go forward with treatment, that putting something in place like peer support, do-it-yourself tools, and some of these other things, just providing more information, feeling more comfortable with the subject. I'm like, there's a piece of me that's like, it took me probably 8 years to like experiencing mental health symptoms to actually getting the right treatment. And there's just a piece of me that wished this program existed, like trying to navigate, my own mental health journey. Anyway, so just kudos to Khendra and your team. They're amazing. So in terms of some of the resources we have specific to the workplace, so we do have a workplace mental health toolkit, creating a culture of support and well-being. This has it's I realized after the fact and some of the feedback we've gotten that there was so much content in there that people have actually broken it up and done like monthly campaigns using the information, which is a good problem to have. But there's resources for executive leadership, for your people managers, human resources, workers who are mental health advocates within their workplace, those champions, ambassadors, everything from how do we create that supportive workplace culture, to tips to planning a wellness event, to those printable things I mentioned earlier with tips on talking to someone with a mental health concern. And then the other thing that we do, so we primarily had been working in research before I came into this role. So we have a decade or so of that under our belt. And we started taking what we learned from that and creating a framework for what's a mentally healthy workplace look like, what actually drives good mental health outcomes. So we developed, we call it Bell Seal for Workplace Mental Health, which it's an employer recognition program, but it's also parts, some of the folks that we work with have called it a workplace policy audit, which anytime I hear the word audit, I'm like, ew.
Yeah.
Oh no, that's never a good thing. But in a way they're like, yeah, this is very thorough in looking at different aspects that contribute to workplace mental health. So yeah.
Wonderful. Well, thank you so much, Khendra and Taylor. You guys have been a wealth of information, and I will, of course, add links to our website, tomarketingmoms.com, to Mental Health America, and also in our social. We're going to be showing all of these resources in our social media when we promote this podcast. So I really appreciate you taking the time to talk to me about mental health in the workplace, and thanks for all of your guidance.
Yeah, thank you so much for having us.
Thank you for making space on your platform, because this is a very important issue. It's just not talked about enough. So we appreciate your time.
Of course.